everyone, my name is Kimberly Rover. Today my presentation will focus on the study of sickle cell screening versus heel stick for newborn screening. My study will show how fast and accurate early diagnosis of sickle cell anemia will decrease the mortality and morbidity in newborns worldwide. Sickle cell anemia is an inherited blood disorder that causes the red blood cells to form crescent shape. This disorder causes severe pain in the patients, and it is growing significantly worldwide. Sources reveal between 2010 and 2050, 14 million children will be born with sickle cell anemia. Newborn screening is the most common test for diagnosing this disease. Without testing and fast treatment, most children will succumb to this disease before they reach the age of 5 years old. The World Health Organization and National Institute of Health have requested technology be created and expanded to areas with low resources. Creating a simple, inexpensive, accurate point-of-care testing method for sickle cell anemia could shorten the time of diagnosis significantly. Also, this could allow critical intervention to decrease death from this worldwide health challenge. So, sickle scan is the point-of-care testing method, which is an ELISA assay, a sandwich method that can be used at the bedside. The importance of this device is that it is easy to operate, a finger stick can be used as a specimen, and results are easily read at the bedside. Sickle scan is used to identify sickle cell anemia, allowing the results to be seen microscopically. So how this point of care testing method works is the specimens are collected. So you would have the specimen either whole blood out of a EDTA tube that's kept at room temperature, or you can use, like at the bedside, you can use a just a heel stick for the newborns. So the specimen is placed on your sample pad. So here you have your blue line, which is your conjugated pad. So your conjugated pad is made up of mouse monoclonal antibody against the C terminus of hemoglobin A chain. So it's the detection antibody here. This little pad right here, this little blue part right here. So then you also have your 3 polyclonal antibodies, which is your hemoglobin A, your hemoglobin S, and your hemoglobin C lines. These are your specific antibodies. So then you also have your control line. Your control line, like any type of point of care testing, your control line is going to always be there. That line is going to always show up because you have to have an internal control. So that's what that blue line is your internal control. And that is made up of goat anti-mouse IgG antibody, which is, they call your label antibody. That's your control line. So that's supposed to always be there. Excess antibody antigen formation will flow past the test line and be captured on the control line. That's what that is right there. So the control line will appear with each testing. Once the test is complete, there may be a line at any of the given areas that represent hemoglobin presence. So basically what you would do is you'll put your sample here. Your sample go on your sample pad. You let the sample flow out. You'll add your diluent to it. So your diluent will wash away all of the antibodies, the junk, all of that stuff that's not that does not have when it doesn't form an antigen antibody complex to have a positive result. So it'll go past your conjugated pad. It'll flow down to the hemoglobin C line, your hemoglobin S line, your hemoglobin A line. So if the specimen has any of these, hemoglobin A, hemoglobin S, hemoglobin C, these lines will show. Okay? This test will identify hemoglobin A, S, or C, and also patients with sickle cell trait. This test is also designed to identify thalassemia as sickle cell disease and the trait. So, which means that if the patient has thalassemia, it's going to show with hemoglobin S and it's going to show with hemoglobin A. So, you don't know which one it is. So, I guess further testing would have to be done to identify which one it is. But at least we will have whether the patient is sickle cell positive or negative. This does not specify the amount of abnormal hemoglobin detected. So it's not gonna show how much it detected, but that it's there. So this right here is showing you how everything is gonna look. So if you have hemoglobin A, you have your line here. If you have hemoglobin AS, this is how it'll look in the middle. Your hemoglobin S, this is what it would look like, because you have your control hemoglobin A, hemoglobin S, hemoglobin C. If it's hemoglobin SC, this is what you'll have, C and S. Both of them will be there. So thalassemia, you'll have hemoglobin A and hemoglobin S. So that's what it'll show. So the conclusion is sickle scan is described as a lateral flow immunoassay technology, which is best suited for a large-scale screening effort in a low-resource area. There is currently no point-of-care testing to diagnose sickle cell anemia in newborns on the market. There are some development and something is being tested, but they have not been successful in producing a test to distinguish different types of hemoglobin, such as hemoglobin A, hemoglobin C, and hemoglobin S, which make this device very useful. This device can differentiate the absence or presence of hemoglobin S and or hemoglobin C in whole blood specimens. Okay? So, this is the reason why we would want a point-of-care testing at the bedside to help diagnose newborns in a timely manner. So, now we'll have Q&A. Any questions, any comments, anything anybody wants to discuss. I have my references and everything here, so thank you for your time listening.